How much of a breakthrough do you think it is?
I do believe this is an important scientific breakthrough. The results are extremely encouraging. I feel very optimistic about this potential vaccine. It did all the things that we expected of it, and so far it seems safe and well tolerated. So I think we can move forward into phase 3 studies with some degree of confidence.
Andrew Pollard saying it's a critical milestone, but then he says there's still lots to do. You agree with that, do you?
Yeah, there is a lot to do. First of all, we have to make sure that this vaccine can actually protect people from getting viral infection. And the study that we published today hasn't shown that yet. It's just simply shown that we do generate an immune response. So that's a big step forward. Those trials, those phase 3 trials, are currently being conducted in Brazil, in South Africa, and in the United Kingdom, and we should get the results of those studies later this year. And that's going to be the next big test.
Yeah, and so those patients involved in the trial are sort of waiting to get it, are they? Is that the situation?
Well, you have to do these studies now in areas where there's a lot of virus, where there's a lot of community transmission. So you take a large number of people and you give half of them the vaccine and half of them a control, and then you wait and see what happens. And what you're hoping for is that a significant number of people who were given the Oxford vaccine will not get infection. And if we get that result, and we also know that the vaccine is safe and well tolerated, then we're in a good position to start producing.
Okay, and already the race is on to secure access to these vaccines that have not yet been produced. The government here has signed deals for over 100 million doses, the American government 400 million doses. Is this the right way to do it? It does seem that every country's, looking after itself here.
Well, Mark, this is absolutely the wrong way to do it, if I might say. This is now going to be a struggle between the richest and most powerful countries to basically buy up whatever vaccine is there. That is not the right way to do it, because countries that are poorer, that don't have the money or the muscle, are not going to get access. What we need is to make sure that the vaccine goes to those who need the vaccine most of all. And we know that there are people who are older, people who are living with chronic illness, health workers on the front line of the disease, people who are from Black and minority ethnic communities. We know who's at risk. They should get the vaccine first, and then everybody else. So I hope that countries can come together to figure out a way of fairly distributing the vaccine. Otherwise, it really is just going to be a race to the bottom.
Well, I mean, that may not happen. What happened to the distribution protocols of Gavi, the Vaccine Alliance, who said exactly that it should go first to those health workers first, I think it was, and then those who need it most?
Well, these were all good intentions, but when reality hits, I'm afraid governments ignore those good intentions and just go in and try and buy up the vaccine that they can. Remember, President Trump tried to buy a vaccine company in Germany, the entire company. So we have to constrain government's enthusiasm here and figure out a global framework, a convention, so to speak, whereby we have fair access to the vaccine. And I hope that wise heads can prevail so that governments can come together. Even in this country, not everybody should get the vaccine at the same time, only those who are most at risk. But it does need leadership. And perhaps we don't have so much of that global leadership right now.
And what do you make of I think the UK survey that said 14% would not have a vaccine, 13% would think about not having it. So, 27% could refuse to have a vaccine. What do you make of that? I think in the US it was 50% are committing to taking the vaccine. That few.
Exactly. Only half of people in the US, when polled recently, would be willing to take the vaccine. Well, this is my biggest concern, that The anti-vaccination movement is mobilizing again and could cause significant harm to public confidence in taking the vaccine. So it's very important that we're as transparent as possible and we explain the science and we explain the benefits as well as any potential harms of a vaccine. And that's why this information we've published today is fully in the public domain. Any member of the public can access it for free. And I would encourage every person who's interested to go and read this paper. It is technical, but it is understandable too, and you can see the way in which the study has been done. And I do believe, having reviewed this paper and published it this afternoon, that we should have every confidence in the Oxford researchers for the incredibly careful way they've done this research and the excellent way they have reported it to be as transparent as possible. But we need to begin now, Mark, to build public confidence in the vaccine program that will come to fruition over the next 12 months.
Yeah, so you know what's coming. I mean, it's the obvious question. Did the Lancet contribute to this crisis in confidence in vaccines with the publication of that paper under you suggesting a link between the MMR vaccine and autism?
Well, that story is 20 years old now, over 20 years old. And there's no doubt that that paper did do harm to the confidence that the public had in MMR and the campaign that Andrew Wakefield waged against the vaccine. But we're in a different era now. Public confidence has been restored in vaccines. And I think that the COVID-19 epidemic that we're living in has really made people realize how important it is to escape this situation that we're now in. And the only way that we're going to escape this situation safely is with a safe and effective vaccine. Yeah. And that's the step forward we're on to today.
And I know you retracted this article after, I think it was 12 years. You regret that now, do you?
I don't regret retracting the article.
No, you regret running it in the first place, obviously.
Oh yes, I mean, if we knew what we knew, if we knew then what we know now about Andrew Wakefield and that work, then we certainly wouldn't have published that so-called research.
And to what extent do you think your publication of that has destroyed for some people confidence in vaccines? What responsibility do you think you hold for that?
I think that certainly the paper when it was first published and Andrew Wakefield's campaign against the MMR vaccine contributed to a decline in public confidence. There's no question of that. But that confidence has been built up again in vaccines. And I do not believe there has been any lasting damage to public confidence in vaccines. When you look at the rates of vaccine uptake in the UK, they're very high. And of course, they can always be higher. But I think we're going into a phase with this vaccine. If we can establish its effectiveness and its safety, I believe the public will be very willing to be recipients of this vaccine because it's the only way to get us out of the situation we're currently in.
But is confidence really being rebuilt when you've got this London School for Hygiene, Tropical Medicine survey saying around 25%, 1 in 4 may not have this vaccine? In the US, as I was just saying, half the population are refusing to commit to taking the vaccine. How do you say that the confidence is being rebuilt? It doesn't look like it, does it?
Well, different countries have different reasons for why they are hesitant about vaccines. So in the United States, there is certainly a very strong, what's called vaccine hesitancy movement or anti-vaccination movement. And that's partly because you've got a very populist government, that people are anti-science, anti-elites, not trusting in the government. And all of those different influences are creating a lack of confidence in a vaccine. but it's symptomatic of a broader lack of trust in government and in experts and elites. In this country, we're in a very different situation. We don't have that degree of mistrust or distrust of government and of scientific experts. We're in a very strong position here where there's very high public trust in the scientific community and very high public trust in doctors. And what we do need to do now is to prepare for a vaccine, and that means building public confidence and expectations in the science and the practice of this vaccine and where it's coming from. So I believe we do have high levels of confidence in the UK.
Right, and look, you've been very critical of the government response to COVID over the months. Slow, complacent, flat-footed, glaringly unprepared. Do you still feel that way? And is it entirely fair when this was a completely new disease hitting the world very suddenly?
Well, Mark, we published 5 papers in the last week of January, and if you go back and read those 5 papers, the entire story of the last 6 months is set out there. Human-to-human transmission, a new virus tipping people into intensive care with a very high mortality rate, the urgent need for PPE, test, trace, and isolate. Every debate we've had in the last 6 months was set out in those 5 papers. But those 5 papers were ignored, and we wasted 6 weeks through February and early March when we should have been building up our public health protection systems so that we could have avoided the terrible toll in mortality that we have seen. So we did know enough, and we did know enough early on to prevent the tragedies and disaster that we are currently living through.
You said the sage scientists were the public relations wing of the government. Isn't that harsh on scientists who, just after all, are doing their best?
Oh, I completely agree. We've got excellent scientists in the UK, and they've all done their very best. But the system broke down. The system failed. Think about it. We have a chief medical officer. We have a chief scientific advisor with their offices. We have a committee called NERVTAG, a committee called SAGE, a committee called SPI-B, a committee called SPI-M. We've got this Byzantine complex system of science advice where lots of different pieces of advice are all being thrown into government, but there's very little coordination, no command and control, nobody takes final responsibility. And yet we knew at the end of January that this virus was on its way. One of those papers said very clearly that the risk of a global pandemic was very real. And the World Health Organization declared a public health emergency of international concern on January the 30th, the biggest red flag that they can wave. And we ignored it. Both the scientists and government did too little, too late. To pay attention to those.
I don't think they ignored it. I think that's a little unfair. But look, we've run out of time. But just finally, Richard. So the man who published the Wakefield paper, you would encourage people now to have this vaccine. You would tell people to have this vaccine. No question about that.
No, this vaccine isn't ready for human use yet.
No. I mean, should we have one? Should we have one that is successfully and safely produced and would be safe for the widespread population? You would encourage them to have that vaccine?
I would absolutely be confident if this vaccine passes safety and efficacy tests in phase 3 trials. I'd be absolutely confident that we would have a vaccine for widespread human use. And it should be produced and deployed as rapidly as possible if we get to that stage.